Many women will find they need some medical intervention to help deal with some of the problems of perimenopause and menopause. Let's first talk about some of the bleeding issues that women in the perimenopausal transition may be experiencing. It's not so much the scant periods that bother people, it's the heavy bleeding that bothers folks. The good news is that we can help take care of it. And indeed, we've already talked about the basic physiology that indeed it's a progesterone issue, lack of progesterone that tends to lead to the heavy bleeding. And indeed, sometimes just some progesterone pills can be very helpful to control this, and your healthcare provider can prescribe these for you. Another couple of modalities are out there which can be very helpful. If you are in good health, non-smoker, blood pressure controlled, basically healthy person, a low-dose birth control pill can be extremely helpful as far as controlling bleeding. The other thing that a low-dose pill can do is, of course, give you contraception. And one of the things that women in this time frame still need to worry about is getting pregnant. I personally have delivered 3 47-year-old women who were in the perimenopausal transition and thought they were just getting no period because they were further into the perimenopausal transition instead of pregnant. These things do happen. Birth control pills can be very helpful to take care of pregnancy protection. And the other thing that the birth control pills will do is to take care of things like hot flashes, night sweats, as well as control the bleeding. So that can be a very valuable adjunct for you. Another option that's out there to control bleeding and also will provide contraception is indeed a progesterone-coated IUD, such as the Mirena. And indeed, that is something that's placed into your uterus by your healthcare provider, but that will give you contraception and control bleeding very well. Indeed, 20% of women that have a Mirena inserted get no bleeding whatsoever, and for the other 80%, the bleeding that they do get is substantially reduced. So it can be a very effective method, and once it's inside your uterus, it lasts for 5 years, so it usually will get you through the perimenopausal transition. So again, bleeding's an issue. Don't hesitate. Talk to your healthcare provider. A lot of options are out there which are really quite reasonable and quite effective. Now, what about for women who aren't doing the bleeding issue or maybe now postmenopausal and indeed are having issues with night sweats, hot flashes, things of that nature? We have a lot of options available. Of course, the classic remedy that's out there is estrogen. And indeed, estrogen therapy is available in many forms. There are estrogen pills, there are estrogen patches and gels, lots of options that your healthcare provider can get for you as regular FDA-regulated medications, which have been around for a long time and very effective. Now, there are some controversial issues with estrogen, and we are going to be talking about this in a later video. However, estrogen use is a well-known remedy. One thing to be aware of is if you have a uterus in place and we give you estrogen, we also have to give you some progesterone with it to counteract any estrogen stimulation of the lining of the uterus. Progesterone takes care of it very effectively, and there are a couple other remedies that are out there these days as well, but we do need to attend to that. But it's not a problem. If a woman has had a hysterectomy, she does not need to take progesterone, and that she just needs to take estrogen because there's no uterus to stimulate the lining of. And again, these are very effective methods to control hot flashes, and we're going to be talking more about this in detail later on. Now, for a woman who doesn't want to take estrogen or can't take estrogen, we do have other medications available. The first one that was actually noted to be helpful was actually the category of SSRI antidepressants, things like Prozac and Celexa, that category of drugs. And of course, we now know you can also use SNRI antidepressants as well. What's interesting about the use of antidepressants is that we actually use lower amount of the medication, lower doses. It can be very effective. Now, of course, one of the benefits of using an antidepressant is it may well help your mood, and in that case, you may need a little bit higher dose of the antidepressant therapy. Unfortunately, as all medications do, there are some potential side effects. The classic side effects that are listed with SSRI antidepressant therapy is, of course, a little bit of weight gain or decrease in libido. Again, with the very low doses that we usually use in this scenario, it's not a problem, but again, you'll need to discuss that with your healthcare provider. But we have those medications readily available, and they are quite effective. Another category of medication that's out there now for hot flash relief is it's been noted that gabapentin, the trade name is Neurontin, which is an old neurological drug used for seizures and headaches, things like that, actually about a dozen years ago was shown to be quite effective for hot flashes as well. Now, because of potential side effects of things like bloating or sedation, we tend to start with a very low dose, but very low doses can be very effective. We give it at night before bed because we're going to take advantage of of its sedation effect to try to get people a better night's sleep, but that is another very effective method that's available. So we do have plenty of pharmacological methods, medications, which are very effective as far as taking care of hot flashes. We can also, of course, take care of bleeding in the perimenopausal transition. And I would just strongly encourage you to speak with your healthcare provider to talk about these options to help get you through and make you feel better. As we've mentioned, for many women, vaginal dryness can be a major issue. And unfortunately, unlike the hot flashes, which do tend to get better over the course of time, unfortunately, vaginal dryness and oftentimes the urinary symptoms that can go along with it do tend to get worse over the course of time without intervention. The good news is we have a lot of ways to intervene to improve these symptoms of vaginal dryness and discomfort for women. We can start with over-the-counter remedies, which are readily available at local pharmacies without a prescription needed. There are basically two forms of remedies that are available over the counter. There are lubricants, which are basically slippery substances which are available over the counter and in general are used at the time of intercourse to enhance more moisture and to lead to more comfortable intercourse. There are many different brands available. I strongly encourage people not to buy a huge amount of any particular variety when they first purchase it, just to make sure it agrees with them, and to try different brands to see what agrees with you the best and what you're most comfortable with. There are many women, though, who need more than just a lubricant, a topical lubricant at the time of sex. For those women, moisturizers are available, and they are a different category of intervention. And a moisturizer is something that a woman will place in her vagina every 2, 3, 4 days, depending on the particular moisturizer, and use it on an ongoing basis. Now, many women who use moisturizers will also find it helpful to use a lubricant at the time of sex as well. But again, these are readily available over the counter, and many women will achieve good relief. The most commonly used moisturizer available over the counter is something called Replens, and it works very well for a lot of women. So again, easy things to try. Do try them. One thing to remember is that once you've been able to resume regular activity, regular sexual activity, you may find you will need less help because indeed there is that old statement about use it or lose it. And indeed, women who are sexually active seem to have more pelvic blood flow, which generates more moisture. So it does seem to help. So frequent sex is a good thing for moisture. Keep that in mind. And of course, many women do use vibrators, which can be helpful as well, again, to increase pelvic blood flow. So these are all good things to be thinking about. For some women, though, the over-the-counter interventions are not enough, and they need more help with vaginal moisture. And again, as we mentioned, this can become more of a problem as time goes by. And also for the women who are having urinary symptoms, indeed, the over-the-counter remedies may not be helpful. They're very good for the vagina, but really don't do a lot for the bladder tissue. So we have to keep that in mind. The most common remedy that we have available are vaginal estrogens. These have been on the market for many, many years. These are FDA-approved substances. They come in several different forms. Creams, vaginal tablets, and rings, which are, again, prescription medications and readily available. There are two basic different kinds of vaginal creams, which can be used with sort of a plunger like Monistat to scoot the product internally. And they also can women can use some of the product on their fingers digitally around the external area on the vulva if it feels dry, and that can be very helpful. You can place it right under the urethra to help that tissue as well. So those have been available for a long time. Women also have available to them some vaginal tablets, which come prepackaged with an applicator to be inserted in the vagina. After an initial period of using them for a couple of weeks on a daily basis, women usually can stretch it out to using them twice a week, and that can be very effective for internal moisture. And there also is a ring available. Again, these products have been available a number of years, and this ring is basically a soft rubber ring which you place in the vagina, looks like the old rim part of a diaphragm without the cup part attached to it, and this can stay in place for 3 months at a time. Of my patients who use the ring, I would say 98, 99% of them do not notice it. They're not aware of it being present, nor are their partners aware of it during intercourse. So this is something that's available, readily available, and even though it stays internally in the vagina for 3 months at a time, it has not been associated with any increased risk of infection. So those are methods that have been available for a number of years and can be quite helpful. However, for many women, using something vaginally on a periodic basis doesn't appeal to them. They find it messy, it's not successful for them, whatever. And there are other methods that can be used. Now, I should mention that women who are taking systemic estrogen, women who are using pills or patches or gels, should get relief from their systemic therapy for their vagina. Now, the opposite is not true because the amount of estrogen that is absorbed vaginally is very, very small. So they will not get relief of hot flashes from their vaginal estrogen. But women using systemic estrogen usually get vaginal relief. Now, some people still need a vaginal booster. It's not unusual for somebody who's using an estrogen pill or a patch to use a little bit of estrogen vaginally for added comfort. It's perfectly reasonable and can work very nicely. So that's another option that's out there. Now, but there is still another option that's available, and this medication has been available for the last couple of years, and this is an oral medication. Very interesting medication. It is not estrogen. The drug that it's actually closest to think about is actually the medication tamoxifen. And what it is a medication that's commonly known as a SERM, or selective estrogen receptor modulator. These kind of molecules bind to estrogen receptors on cells, and in certain tissues act like estrogen and turn the cell on. In other tissues, they can actually block estrogen activity. But this particular SERM that works well for the vagina actually will make the vaginal moisture much better. It also, in general, will be effective as far as bladder symptoms in general as well. And this is a medication that you take once a day with food because it's better absorbed and can be quite effective for vaginal symptoms. So again, this is a new medication in our armamentarium, but can be quite effective. So bottom line is that I encourage women who are experiencing vaginal dryness, if the over-the-counter remedies haven't taken care of the problems, please do talk to your healthcare provider because we have a lot of options that are available to help you. Now, the one other thing I do want to mention is that when you get a prescription for something like a vaginal estrogen, that it has all the warning signs and problems that can happen to people who take systemic estrogens, and it's really very unlikely that these things will happen because the amount of estrogen that's absorbed into the bloodstream is very, very small. And indeed, the North American Menopause Society, of which I am an active member, has actually gone to the FDA and asked if these warning signs can be removed from the packaging, and this is under consideration. So stay tuned. We'll keep on having more information on that available for you. So again, bottom line, anybody who's uncomfortable, please talk to your healthcare provider. There are a lot of remedies that we can offer for you. Even if a woman is having no symptoms whatsoever of menopausal issues, she's not having hot flashes, she's not having vaginal dryness, she feels great, I always talk with those women about two organ systems which are impacted during menopause. Those two are basically your bone system and your heart system, cardiovascular disease. Indeed, it is well known that women after menopause are at significantly increased risk of bone loss. Estrogen does help protect the loss of bone. Now, there are many things that women can do to enhance their bone health, and although estrogen therapy certainly helps prevent bone loss, it's not essential that every woman take estrogen for that reason. There are many things that all women can be doing. One is to certainly avoid known health hazards. For example, we've already talked about the fact that cigarette smoking leads to further bone loss on several modalities. First of all, women who smoke go through menopause much earlier than women who don't smoke, and when they do become menopausal, they lose bone much faster. So smoking is a good thing to avoid if you possibly can. Excess alcohol can also lead to more problems with bone loss and fracture. So if you can avoid excess alcohol, that's good for a whole bunch of things. We also encourage all women to take in certain nutrients. We encourage all of our patients basically to take about 1,000 units of vitamin D a day. That's hard to get nutritionally, so that indeed most women need to take a vitamin supplement, either a vitamin D itself. Many women are already taking a multivitamin that may have the 1,000 units of vitamin D in it, but you want to make sure you're getting some D in on a regular basis. And if there's any question, your healthcare provider can measure a vitamin D level to make sure you've got plenty of D on board. The other issue that's out there that is perhaps a little more controversial controversial, is indeed intake of calcium. And ideally, if all American women were to drink 4 glasses of milk a day, that would probably be pretty good for their calcium. Of course, very few American women drink 4 glasses of milk a day. But the key thing is that your most readily available source of readily available calcium is dairy products. That indeed, 1 dairy helping, an 8-ounce glass of milk, 8 ounces of yogurt, 1 ounce of hard cheese like Swiss or cheddar, something like that, will provide about 300 milligrams of calcium. So if a woman is indeed taking in 4 dairy helpings a day, she will be obtaining 1,200 milligrams of calcium, which is the recommended amount of calcium that we encourage postmenopausal women to take in. However, we are aware that most women are not going to be getting in 4 dairy helpings and will need some supplementation. Now, truly, there are other sources besides dairy. Indeed, calcium is available in broccoli, and it's also available in kale. But once you get away from those 2 vegetables, there aren't a lot of other really calcium-rich dietary sources available. So what I always encourage my patients to do is to count up how much calcium they're getting in from their dietary sources, and then to supplement up to 1,200 milligrams a day, which is the recommended calcium allotment. And calcium supplements are available in many, many forms. Indeed, some come with vitamin D as well, so that may be a convenient way to get it in. If you're not getting in any calcium in your diet, you're taking your calcium exclusively through supplement form, don't take it all at once. You're going to do far better getting it absorbed in 2 separate helpings, so to take, say, 600 in the morning, 600 in the evening. And that's a reasonable way of getting it absorbed. And again, one other thing with calcium, it comes in many different varieties. So if one doesn't agree with you, get a different one. Talk to your healthcare provider about a modality that might work for you. But you do want to get some calcium in general. Most women do. Now, the other area of things that can help your bone, besides good calcium intake and good vitamin D intake and avoiding known problems, is indeed exercise. And weight-bearing exercise is terrific. And if you possibly can get it in on a daily basis, that's just terrific. Now, I don't mean to say anything bad about swimming. Swimming is fabulous exercise for your cardiovascular system, but if you are an avid swimmer, you still want to do some extra weight-bearing exercise as well, because that will help your bones strengthen. And indeed, a good source of exercises to think about, there's a great book called Strong Women, Strong Bones by Miriam Nelson, which has a lot of excellent advice on weight-bearing exercise, which you can do at home if you don't want to go to a gym or anything like that. And I would strongly encourage women to partake of some weight-bearing exercise as well as getting in really good calcium and avoiding known sources to help you lose calcium. That being said, I'd like to turn now to some heart health issues. The other organ system that's impacted by menopausal loss of estrogen is indeed cardiovascular disease. Women postmenopausally are at higher risk than we were premenopausally, and there are many things that we can do, though, to help promote good heart health. One thing that I always encourage women to do, besides sticking as closely as they can to their best body weight, their ideal body weight, and keeping an eye on their lipids, is to get involved in a regular exercise regime. Exercise is fabulous for just about everything. We've already talked a little bit how it's good for your bone health, which is terrific. It's good psychologically. There's nothing better than doing a good bout of exercise, for your emotions and mood, but it's fabulous for your heart health, your cardiovascular system. And getting involved in a regular exercise regime, including both aerobic exercise and strength training, is really the way to go. So again, talk to your healthcare provider to make sure she or he is comfortable with you getting exercise, and most people can, and then work out a program that will work for you. And in general, the more the merrier. If you can get it in 3 times a week, if you can get it in 4 times a week, that's even better. So the more days a week you can exercise, the longer you can exercise, in general, the better health you're going to achieve. So that's good for your heart, it's good for your bones, it's good for your head, it's good for just about everything. So at this point, I think that we've discussed some of the basic issues involved in menopausal health care, and we'll start talking about some of the other issues in some other episodes.